Hello everyone. Now we are going to discuss about disability indicators. So health indicators is important for long and short, and in that again this disability indicators is also important, and it will come independently as short notes or very short also. But why we are discussing it separately means so many students will be confused. What is DALY? What is QALY? What is HALE? What is the problem with this all? What is the full form and all like that, so many students will be confused. And today in this lecture we are going to clearly explain what are these disability indicators, and I'm Dr. Anusha, assistant professor in the department of community medicine. So now we will see what is disability indicators, and we all know health definition. So it is a state of complete physical, mental, social well-being and not merely absence of disease or infirmity. That means a healthy person can perform full range of daily life activities. So he is not compromising on any activities. So disability means the person is not able to perform this full range of daily life activities. So as a definition, if we want to say, it is the percentage of population unable to perform the routine activities due to injuries or ill health. So that means the person is either having injuries like accident and all, or ill health like fever and all. So because of this injuries or ill health, the people are not able to perform their routine life of activities, like they are not unable to go to their work, they are not able to go to school, or they are not able to perform bathing, eating kind of thing. So they are not able to perform their routine activities. Usually they do every day, so because of this they are not able to perform. So that is disability indicators. And these disability indicators are of two types. One is event type, and another is person type. So event type means because of that event can be injury or ill health. Because of this event, so the person is restricted activity. So number of days of restricted activity. Or because of that event, the person is bed disabled. So that is bed disability days. Or because of that event the person is not able to go to work, so work loss days or school loss days within a specified period. It can be 6 months or 1 year, whatever it is. So this is event type of disability. And the second type is person type disability. So because of that event the person is not able to perform certain type of activities, so that is person type. And again this person type are two subtypes: limitation of mobility and limitation of daily activity. Mobility means so the person can move here and there freely, but limitation of mobility is the person is either confined to bed, or the person is only confined to house. They are not going outside or for work or for studying or whatever it is. So the person is having a limitation of mobility. Or one more type is limitation of daily activity. That means because of whatever is the event, the person is not able to perform basic activities of daily living. ADL we will call, activities of daily living. He is not able to perform. Like usually he will eat, wash, bath, dressing. So this basic daily life activities also he is not able to do. So that is limitation of daily activity. So these are the two types of disability indicators, event type or person type. Along with the person type and event type disability indicators, there are other types of disability indicators like Sullivan's Index, DALY, HALE, QALY and all. So now we are going to discuss about all those. And first we will start with Sullivan's Index, and we will also call it as Disability Free Life Expectancy, DFLE. So as the name suggests, disability free life expectancy, that means a person how many years that person will live free from disability. So free from disability, that person live for how many years. So definition is average number of years an individual is expected to live free of disability. So if the current pattern of mortality is disability continue to apply. So this mortality indicators, morbidity, disability indicators will change from year to year and from country to country, place to place. So by keeping current patterns of mortality and disability, on an average, how many number of years? So it is expected to live free from disability. So that is the definition. And how we will calculate? It is calculated by subtracting the duration of disability, that is bedridden and unable to perform major activities, from life expectancy. So that means from life expectancy at birth we are deducting how many years we are having disability. So disability means we are not able to perform major activities. Say for example, in India life expectancy is 70 years currently, and from that life expectancy, say for example the person suffered with disability for about 5 years. That means say for example at the age of 30 years the person got accident and he was unable to perform major activities for 1 year, and after that he got fever after 1 year, and that caused a disability for 6 months. So like this cumulatively throughout the life, so he suffered with the disability for example 5 years. So from 70 years we are deducting 5 years. So that will give 65 years. So apart from those 5 years, the remaining 65 years that person lived free from disability. So that is only disability free life expectancy. Sullivan's index is over, and now we will see what is HALE, health adjusted life expectancy. So this is to measure healthy life expectancy. So this is also similar to Sullivan's index because it is also measuring how many years the person is living free from disability. Healthy life, how many years he is living. But it is slightly different because it is also deducting mortality. So this HALE is equal to the number of years in full health that a newborn can expect to live based on current rates of ill health, that is morbidity and mortality. So that means from life expectancy we are not only deducting how many years the person suffered with disability, but we are also deducting how many years priorly he died. So for example, as we have seen, the life expectancy in India is 70 years. So from that we are deducting 5 years because throughout the lifetime he suffered with disability or morbidity for 5 years, and he died at the age of 60 years. So that also we will add. So 5 plus 10 is 15. So from 70 years we will deduct 15 years. So that will be 55 years. So that person, the person's HALE, health adjusted life expectancy, is 55 years. So it is slightly different from Sullivan's index in that here we are also deducting how many years priorly the person is dying. Mortality also we are deducting, but Sullivan's index only morbidity we are deducting. And now we will discuss what is QALY. QALY is quality adjusted life years. So what does it mean? It is a measure of disease burden including both quality and quantity of life lived. That means it will not only include quantity, but it will also include quality. Quality means whether the person lived in perfect healthy life or not, and it is used in assessing the value for money for a medical intervention. That means say for example a person is having disease, say for example fever, and he got admitted, and because of medical intervention he lived for some more years, but without that medical intervention he could have died. But with that medical intervention we are adding some years to that person. So that is, so with help of this QALY we can assess value for money of a medical intervention. And third point is, this QALY is based on number of years of life that would be added by intervention. As we discussed, because of any intervention how many years it is adding, and each year in perfect health is assigned a value of 1, and from 1 from above and down to the value of 0. So 0 is death, 1 is perfect health. Say for example, because of a medical intervention, 1 year of life is added, and that too the person lived 1 year in full health, quality health. That means it is not, in the definition itself we have seen it is not only see quantity, it will also see quality. So quantity means 1 year he lived because of that medical intervention, plus into one utility value. That means he is in perfect health for that 1 year. So 1 QALY is equal to 1 year of life added plus that too in 1 year perfect life. That is one utility value. Say for example 0.5 QALY means 1 year of life lived, but only 0.5 6 months he lived in perfect health. So that is 0.5 QALY. So if full year lived in perfect health, so the QALY will be 1. But if half year lived in perfect health means the QALY will be 0.5. For example. So this is about QALY. So QALY means, as we discussed, because of any intervention, how many years it is adding, and that too not only quantity but also quality. So this is diagrammatic explanation for QALY to understand easily. Say for example, without intervention, the person is dying at first point. So, so this many years the person is living till first point of death. But after giving intervention, so with some intervention, he is not dying at first point. So he is living till second point and then dying. So without intervention, the lifespan is this blue one, and with intervention, so this wheat colored, so this area is added because of intervention. So that is QALY. So the number of years added with help of any intervention. So both quality and quantity matters. And now we will see what is DALY, Disability Adjusted Life Years. So it is measure of burden of disease in a defined population and the effectiveness of intervention. How we will know burden of disease means, if the DALY is more, disability adjusted life years is more, then the burden of disease is more. And because of any medical intervention, DALY is decreasing means that intervention is effective. So here we are not subtracting for life expectancy and all. We are directly measuring how many years the person is being lived with disability. So this disability is defined as years of life lost to premature death and years lived with disability. That means it is not only taking how many years a person is living with disability, but it is also adding because of premature death. So how many years is being lost? So that is also what is disabled, what is lost, together it is measuring. And what is one DALY? One DALY is equal to one lost year of healthy life, either due to death or due to disability. So to understand easily, we will see with one image based example. So DALY, disability adjusted life years, is equal to years lost with years lived with disability plus YLL, years lost because of premature death. So in this image down, one image is there, no? So from birth, so from birth is the child. So from birth is expected life years. So that is life expectancy at birth. Say for example in India it is 70 years. So from birth to expected life years. So from birth to death no one will be living without a disability or injury. So in between the person will suffer either with the disease or with any injury. Say for example one person suffered with fever for 6 months at the age of 10 years. So that is the orange color. So this green is full health, and orange color which is there, either it is disability or disease or injury, whatever it may be. So this orange one, so for 6 months the person suffered with fever, and after that the person got injured and he suffered with the disability for 1 year, and that too recovered, and after that also again he got fever. So like that over the years, so from birth to death, how many years the person is either living with disease or disability will be added. So it is cumulative from birth to death. So that is years lived with disability. So the orange color one is years lived with disability, YLD. And because the life expectancy in India is 70 years, that doesn't mean that everyone will live till 70 years. So some people will die before reaching that life expectancy. Say for example, the person died at the age of 50 years. So this is because of early death. He is dying at 50 years, but the actual life expectancy is 70 years. So he is dying 20 years previously. So that is YLL will be 20 years. Say for example, this orange, all with disease and disability cumulative, it after adding everything, it came as 5 years. So YLD will be 5 years and YLL will be 20 years. So total will be 25 years. So DALY will be 25 years for that person. But together for males we can calculate all, for females we can calculate together, for all diseases we can calculate DALY. So but we should calculate like this. So in the previous slide, we have calculated DALY for one person to understand simply. So as we discussed, we can calculate together for all persons in the world or country, or DALY for each disease, like that we can calculate as we discussed. So here together how to calculate, that also we will see. So YLL is years of life lost. So together for all person, how we can calculate this YLL. So, say for example, all over the world we are calculating. So, global life expectancy is 75 years. So, highest is 75 years in Switzerland and Japan. So, this YLL is, so all the persons will not live till 75 years and all the persons will not die at same age. So, different persons will die at different ages. So, how to calculate YLL for all persons together is number of deaths at each age. So, at each age, how many deaths happening? That n into remaining how many years are there. That means a person, so 20% died at 1 year. So that is 20, n will be 20. So remaining years, 1 year means into 74. So like that for all ages, 1 years, 2 years, 3 years, till 75 years we will do. So number of deaths at each age multiplied by expected remaining years of life according to global standard life expectancy. So that is how to calculate YLL. And now we will see how to calculate YLD, years lived with disability together for all persons. So this is number of incident cases due to injury or illness. So it can be injury or illness like we discussed. So total how many cases? Total how many cases of injury plus illness? So that is n, and it is multiplied by, so duration will be different for different. So we will take average duration of disease. And here we will also add weighing factor to reflect the severity of disease. So all the diseases will severity will not be similar, no. So here as we are calculating together, we will add weighing factor also, which will reflect the severity of disease. So 0 means perfect health and 1 is dead. So like this, YLL plus YLD is equal to DALY. We can calculate together for all the world, or together for the country, or together for each disease. So with the previous formula we got confused, and why should we do this much complicated calculations and remember? Because this DALY can reveal surprising things about population health. Say for example, in 1990 WHO report indicated that 5 out of 10 leading causes of disability were psychiatric conditions. That means to know what is the leading cause of disability, that means because of which disease the persons are suffering. Suffering means either they are losing their life due to premature death, or they are living their most of the life with the disability. So if YLL is more, then also DALY will be more, and if YLD is more, then also this DALY will be more. So which disease is stressing our population more? So because of so many health programs and all, we have decreased mortality rates now, but now we are suffering with the disability more. So which disease is taking it is the reason for more morbidity or disability or suffering of the population, we can know with this DALY. So psychiatric, in that example, psychiatric and neurological conditions account for 28% of years lived with disability, but accounts for only 1.4% of all deaths and 1.1% of years of life lost. That means, so although the psychiatric and neurological conditions are not taking lives, that means it is not causing death or mortality, but it is causing more disability. So which disease is causing more disability, we can know by seeing this DALY. So one more example. So in 2021, India. So how are the DALY patterns per 1 lakh population? So 2020 means one means we remember so many COVID cases. Lockdown was there, second wave was there. So this because of COVID, so much DALY was there. So much DALY means together with life lost due to death and life lived with disability, because of the disease and because of the lockdown we were not able to go to work, we are not able to go to school like that. So it caused a disability. So disability adjusted life. So that COVID caused more DALY. And apart from COVID, ischemic heart disease is having next high DALY after that preterm birth complications, COPD, stroke, TB, road traffic accidents and all. So by seeing this, what we are understanding, so which disease is carrying more disability, which disease is affecting more population. So we can know that by seeing this DALY. That is the importance. So after discussing this much detail, by now we have known what are the uses of disability adjusted life years. So first is to assist in selecting health service priorities. So as we discussed which disease is causing more DALY, so that we can give priority in giving health services, and to identify the disadvantaged groups. So in the last slide we have seen that because of preterm births also causing more DALY. So that also, so like that we can identify what are the disadvantaged groups, and targeting health intervention. So which is the most public health problem, and which health interventions are utmost important to give now. So like that also we can know with help of DALY. And measuring the result of health interventions. So say for example, because of COVID, so much DALY was there in 2021, and vaccination was introduced, social distancing, masks, so many interventions were given. So because of that interventions from 2021 to 2022, so DALY decreased or not, we will see. So if DALY is decreased means it is telling that so because of this disability or problem is decreasing, like that we can know. So measuring the result of health intervention. And another use is providing measures for planning and evaluating programs. And as so many students will be confused between QALY and DALY, so we will see briefly about what are the differences between quality adjusted life years and disability adjusted life years. So QALY means so full form we have seen, and QALY measures the quality of life in health gain. So we have seen that because of medical intervention, how much years are gaining. So we are seeing in QALY. And DALY means it is not gain, it is loss. So DALY measures the health loss in quality of life. DALY means how many years we are losing because of premature death or because of disability, how much we are losing. So QALY is gaining, and QALY is expressed in either 1 or 0. So QALY is like positive health indicator, you can think. So QALY 1 is perfect health and QALY 0 is death. So DALY means you can remember like negative health indicator. So DALY 0 means the disability 0, that means perfect health. So DALY 1 means disability highest, that means death. So like this you can remember the differences between QALY and DALY. Thank you all. Like, share, subscribe for further updates. And comment down if you need any specific topics for further discussion.